This is a Rogue Media Network podcast.
This is episode 2, Dr. Lindsay Cash on the Fee-for-Service Dentist podcast. Dr. Cash is wonderful. She's going to lay it on the line. You're going to hear a little more details in this episode about what it meant to go out of network, what it took, how she got her practice off and running, and what it looks like today as a result of all the effort. And you'll get a sense of just how much time someone puts into their own business to make it theirs in every way, shape, or form. You don't want to miss this, folks. Enjoy. Thank you for listening. You appreciate it, you like it, click like, share it with your friends, subscribe. YouTube videos are all out there, and it's on anywhere you get your podcasts. As always, the Fee-for-Service Dentist podcast is brought to you by Kettenbach. Kettenbach Dental is excited to announce the first major advancement in fluoride varnish treatment, Profacel. It's no longer with alcohol or resin. It's in a dimethicone mucoadhesive gel. It leaves a smooth and silky feeling. No more grit. Contact Kettenbach today for more details and do more varnishes that patients will appreciate. 877-532-2123 or visit kettenbachusa.com. Have a great day.
My name is Drew Burns, and I'm a part of a small group of dentists who believe something crazy. We believe the standard of care is just not good enough. We demand the best of ourselves and the best for our patients. We believe that the best way? No, the only way to practice dentistry is on our own terms. If you ask the dental consultants or the corporate CEOs, they tell you that what we're doing isn't smart, that fee-for-service dentistry is dead, and that the golden age of dentistry is over. Yet, while others focus on profits first, we focus on the patient first. And yet our offices are some of the most profitable in the entire country because we invest in ourselves and we are doing things right. It's our name on the door and it's our reputation on the line. My name is Drew Burns and I am a fee-for-service dentist. This is the Fee-for-Service Dentist podcast and these are our stories.
Now, what does the team feel like at this point? And no, I don't want to ask that. I'm sorry. Scratch that question. So the end of the second year, you've done it. What did your numbers look like at the end of that year?
They were up considerably. And write-offs were down. Obviously, write-offs and adjustments were down. I don't remember those off the top of my head, but they were considerably up. Still a ton of write-offs and adjustments because I'm still in network with the others.
Plus your membership plan, there's going to be write-offs in there.
Yeah, absolutely.
Mm-hmm.
Yep.
Yeah, people forget that, because we have a very active membership plan, and we'll look at it. And I have a new office manager. We're talking about it. She's looking at the right. I'm like, we gotta classify some of these write-offs. We're not just throwing them in here. Some of them are professional courtesies, and some of them are actual membership plans.
Yes.
So what do you do? The rest of it has to be downhill, because if you took care of the gorilla in the room, the 50%, I bet you your team has got to be itching to get the rest of them out, if not you.
Yeah, and it was, I think that Delta was one of the hardest ones because it's the first one and it's the biggest one.
Mm-hmm.
And so once we did that and my team realized that we could survive that, and once they saw what the potential was when we weren't still having hundreds of thousands of dollars worth of write-offs from these others, I initially made the decision I was going to go through and just very stepwise and make the smart decision to say, okay, I'm going to drop. Do I want to drop the one with the next lowest reimbursements or the one that affects the next fewest number of patients? How am I going to decide what to do? But then when we started doing the packet and the video and explaining to patients, it became too cumbersome to be like, okay, this person we need to have the conversation with, this person we don't. And the thought of doing that over and over and over for the next 2 years, every 6 months or every 3 months or whatever, whenever we decided to drop a next one, I was like, I'm done. So we dropped them all at once and we had the conversation with everybody and we were just done with it.
At what point did this happen?
So everything was finalized. We started having conversations in summer last year with patients and everything we were out with everybody finalized by the end of December, early January this year.
Okay, so ballpark, was it 30% of your practice, 20% of your practice?
Remaining on insurance, on plans, it was no, the vast majority of my patients have insurance participation. So we easily had, gosh, I would say fully fee for service and in-office benefit plan probably was 40% of my practice. It was probably 60% of my practice was affected by insurance in some way, shape, or form.
Wow, because you cut the 50%, you cut Delta out. So those people say, wow, that's still a huge number. That's big. I'm surprised. I'm surprised at that. So, but this had to go well, I'm assuming. Do you have the results yet?
It's gone really well. Our numbers are higher than they've ever been.
You still doing
and
4 days a week?
I am still doing 4 days a week.
So I gotta ask you, because you put that package together, and that had to take some time. Can you give people an idea of what you spend? Because, I mean, in other words, how much time you're spending? Because you're at the chair 4 days a week. You're owning the practice. You're following up on the county, right? So let's say your chair side is 30 hours fair, 32 hours fair.
Yeah.
Right? How much time would you say per week you spend on the business of your practice? And then how much time do you spend on following up with your marketing, doing these type of letters, creating video content? That's, people forget, that's a big part of a successful practice. Give us some idea on those times.
I work a lot. I'm really trying to balance, bring more balance to work life. But I'm failing at that miserably right now because I've kind of had to be scrappy right from the start. So I go in early.
You got punched in the mouth early. Come on.
Yeah. So right now it is a lot. I just now got to the point where I'm blocking Wednesday afternoons, the last couple of hours off for admin specific time, but I'm normally going in on days off. I'm staying late, I'm going in early. So I'm still kind of in that grind state right now, but I don't want to be there forever.
Well, no, you don't. But I just think you gotta have a realistic. I see so many posts on Facebook about, I'm looking to back off and do that. Listen, it's gonna it's gonna show up somewhere. You want all this, but you're only willing to do this.
Yeah.
It doesn't work like that.
Yeah.
But you have the ability, and you've articulated it much better than I could. The ability to really make your practice a reflection of who you are and what you want it to be. That means you got to have your fingerprint on a lot of things, because you're not at the point, I don't think yet, of the comfort of, okay, I have this is under my control. I'm out of insurance. I have full control over this ship. Okay. And now I can start to delegate certain tasks. So now I'm going to have to probably bring in some people so that I can give them tasks that I can inspect the results, right? I'm just not going to abdicate it. I'm going to delegate it. It's a huge difference.
Yeah.
And you can then try to get a little more of your life work balance, but you now have a little more history with your earnings, which you're just scratching the surface. This thing is going to blow up for you. I'm telling you. You're going to need to make sure you have help that comes in. You're probably going to need another doctor, your rooms, et cetera. And people got to have your culture. They absolutely have to have it in their DNA. So be careful who you bring in.
Going out of network can be really scary, but staying in network can be even scarier and riskier too, long term. Insurance reimbursements aren't even keeping pace with inflation, which can really affect the quality of your work, not to mention the quality of your life. I'm Allison Bernstein.
I'm Dr. Josh Bernstein. We went out of network over 20 years ago, and we can show you what worked, what didn't, and how you can do it with minimal risk.
ThriveOutOfNetwork.com teaches you everything you need to know, including the most important part, which is getting your team on board. It teaches them how to communicate with patients and getting them comfortable with the entire process.
Go to ThriveOutOfNetwork.com and check it out today. That's ThriveOutOfNetwork.com.
the time that you spend is making it your own. You'll never, ever regret that.
Yeah.
I'm sure you would like to reallocate it in the future, but because you've done it, you'll be in a much better position to change in the future.
Yes, 100%. And, I think that that's a misconception for a lot of people, especially when you look at hiring somebody like Ideal Practices, or you look at hiring a consultant. A lot of people are just looking for a quick way out and an easy way out, and they just want to show up and get thrown the keys. And that's not what this is. Like,
No.
this is your vision, and this is your dream. And there are
Well,
people
if
that
you want it to be your dream and your vision, then you have to stay with your
Right.
hand on the wheel.
Yeah.
Sorry,
Yeah.
go ahead.
No, it's not, I'm not to a point yet where I can, toss the keys to somebody else and say, keep it running like I want to. But I'm really proud at all the changes that we've made and the direction that I've been able to take my practice.
What does your team look like at this present day as of May 17th, 2024?
Yeah, I have 2 and 2 people up front, 2 hygienists, 2 assistants, and me.
Okay. And you're using 5 rooms presently?
5 rooms. Yep.
Okay. And you are plumbed to do 7?
I'm plumbed to do 7. Mm-hmm.
Have you started to think I might bring another doc in a day or 2 a week, or no?
I'm tossing around the idea. The hard part for me is going to really be trusting that. I've put so much into building my practice and building my reputation and office culture. The thought of bringing in an associate right now is scary to me.
Well, I
Which
wouldn't dive in, but I think you can consider, like, if you have a relationship with someone that you know them, you know their dentistry,
right.
and can they come in and, hey, you want to work a day a week here, and then you can do your admin on part of it. So it's not an absentee hire,
Yes.
and
Yeah.
I think that would be smooth. Because I also think, like you said, yeah, you have this opportunity. You can do nights, you can do weekends. All that stuff comes at a cost because your team is tight, right? You got 4 days, your team is solid. You start adding things, well, that's more than they want to work. Now you have to bring in a part-time, and the chemistry changes a little bit, and you can, careful what you wish for on certain things,
Right. Yeah.
Yeah.
It's a delicate balance. And I think that staffing and team management will forever be one of those things that is one of the hardest things that we all do and that we all face, because it's such a dynamic, and it ebbs and flows. And keeping an office culture tight and strong, and keeping people happy, especially in today's environment with hiring and staffing issues and all of those things. We're battling a lot of things right now that I don't know that we've necessarily seen as readily in other times in dentistry. Staff wages.
Oh yeah, we're seeing
Staff,
it. It's
it's crazy.
and it's in a small town. That's also means smaller working pools. So
Yeah.
you feel it, because it kind of runs right through you, and it's tough. It's tough. We're seeing that a lot.
Very much.
Okay, so what do you see? What do you see is going to happen?
I very much am somebody that believes in staying in my lane and having an abundance mindset. I don't care about the noise that's outside. I don't care about, the people that are screaming, recession and the sky is falling and you have to be in network with a million different people. I just want to stay in my lane, and I want to do really high quality dentistry on patients that appreciate what we do. And all I can say is that the direction that my practice is going right now is the direction that I always hoped that it would. And I just feel very blessed and fortunate to be where I am right now, and excited about the things that are heading my way in the future.
What has your overhead look like? Do you have an idea on that?
Yeah, overhead for us right now is right at like 57,000 a month.
Well, 57%.
So percent overhead percentage is still high. Percentage, our overhead is, yeah, it's pretty high. It's pretty high right now. I'm still in that startup phase life. But since going out of network with everybody, it's balancing out a lot. Yeah.
Because I think I think I would be shocked if it doesn't get down into those numbers,
Yeah.
55, 60%, where the average is 75
Yeah.
across the country. I think the latest I saw was 79%. I
Yeah.
heard
Yeah.
Howard
We're up
Fran,
there.
Jordan Christensen taught. So
Yeah.
yeah. So you're able to practice the way you want. You're doing what you want. What are some of the things you talked about? Clear aligners, spear. Are you doing a lot of full mouth rehab? What are some of the things that you're able to do that you really enjoy?
So just doing comprehensive dentistry and being able to talk to patients about moving away from single tooth dentistry and patching things up to, rebuilding bites and looking more towards comprehensive dentistry and full mouth rehabs and, setting things up to do full mouth rehabs later on with clear aligners, like just looking at the big picture and being able to explain it to people how when your back teeth and your front teeth aren't working together, they destroy each other, and getting people to understand that. And that's cool. If somebody's not ready to look at doing comprehensive dentistry, like that's fine, but you at least need to understand what that means and what that could look like in the future, and that things, will continue to break down until things are fixed properly.
Yeah, beautiful thing. All right. Any pieces of advice that you'd like to share with folks along your journey that either you should have done it sooner or that you learned that you can help some other people out with?
I don't regret any of the obstacles that I've had to get past to get to where I am today. I think that the most valuable thing for me has been able to take away what I don't want in my practice from all of those experiences, and how I don't want to run my office or don't want to treat my team. And really just coming from a place of an abundance mindset and understanding that, you're going to have team members that come and go sometimes. People will move, people will quit, you'll have to let people go. And understanding that it's okay for your vision to change and evolve over time, and that that's healthy. And really just not limiting yourself. I feel like there's so many people in our industry that come from a scarcity mindset and a very limited and limiting belief mindset of feeling like they're trapped, but they can't do anything about it because this is just the state of dentistry and it is what it is. And I can't drop because nobody else is dropping. And that just frustrates me, because if I can do it from a scratch start at the 4-year mark, then there's no reason why anybody else can't do it. It's completely obtainable.
Okay. Now, what were some of the things, last question I'm going to ask you on dentistry, what were some of the things that you learned in the horror stories that you started from that allowed you to be in this position now, having this conversation?
The biggest thing was how to treat people and how not to treat people. I watched so many of the owners that I worked for not only treat me extremely poorly and take advantage of me, but do the same of my team. And I think for a long time, there's a certain subset of our profession that felt like they could just do that because staff or team members were a dime a dozen, and like, if you don't want to work here, that's fine, I'll find somebody that does. And now the tables have turned, and now there's team shortages. And I don't use the word staff because staff is an infection. Like, this is my team, this is my work family. And that doesn't mean that everybody's always going to be on my bus or on my boat rowing the same direction. And maybe they need to go a different direction, and that's okay. But what it does mean is that the team members that I do have, I'm gonna certainly do everything that I can to make sure that they are better for having worked in my practice and have been a part of my dream. I want anybody that works in my practice to feel like they left a better person because of it in some way, shape, or form.
Any regrets with having the 2,500 square feet right from the start?
No, none.
Of course not. Most people start too small. That's my feeling.
Yeah.
Or they don't start with enough of the end in mind.
Yeah, that was my thing. I wanted space to grow. And now, honestly, in hindsight, knowing the direction that I took my practice and that I wanted to go, I probably could have gone a little bit smaller. But now I've got room to grow and bring in an associate or bring in a specialist, or, cut my hours back a little bit and do some of the more, some more dentistry that I want to do. I don't do things that I don't want to do. I don't do procedures that don't bring me joy. Life is too short. I'm not I'm not going to make myself miserable every day.
But I guarantee if it's something you wanted to do, you'd get the education, you'd get the training, you'd do it at a high level, all the things that you said you want to be able to do. So, not surprising. Well, a pleasure. Pleasure speaking with you. I do have one last question. It's not a dental question. I try to get everybody's first time on asking a question like this. So if you could go back in time to any place, anywhere, do anything with anyone, where would you go?
Oh man, this is such a sappy answer, but
Lay it on me.
I would go back to my son's birth. I didn't get to hold him for 3 days.
Oh my
So
God.
I would have gotten to hold my son when he was born. Yeah.
Now, is that because of the early birth?
Yeah, they took him straight to the NICU and they were doing all sorts of tests on him. And then I had my abdomen split open, so I wasn't going anywhere. I wasn't going anywhere fast. So I regret that, my family all got to see him and my husband got to see him and kind of look at him from afar long before I ever did. So if I could go back, I would be able to see my son on the day of his birth.
How is your son doing today?
He's great. He's great. He's wild. We had kindergarten award ceremony this morning. So he's great. I feel very fortunate.
He's wild. My mother would say, he's just a boy. That's just how boys are.
Yep, it is.
I tell you what, it covered a lot of the crap that I did as a kid. Let me tell you. I had two sisters. Oh, it's a boy. Oh, thanks, Mom. Yep.
It's always interesting. You never know what you're going to turn the corner and see in my house.
Well, I can't appreciate you enough. Thank you very much. So thankful. I love your story. I would love to have you on. Can you call me or hit me up like in 6 months? I'd like to do a follow-up to see how everything's cooking. I know what the answer is going to be, but I just want to hear from you and talk to you again. So
yeah, let's do it.
please. Okay.
All right. Sounds good.
Lindsay, thanks a million. Appreciate it.
Thanks so much. Thanks for listening to the Fee-for-Service Dentist Podcast. If you would like to share your fee-for-service story, please fill out our contact form at ffsdentistry.com. Also, be sure to join our Fee-for-Service Dentistry Facebook group. For help starting your dental membership plan, visit dentalmembershipdirect.com and membershipmastercourse.com. Finally, for help with in-house financing, visit dentalfinancingdirect.com. And don't forget, your story is what you make of it. This is your name on the door and your reputation on the line. Thanks, everyone. We'll see you next time.
This has been a Rogue Media Network production.